Good afternoon, everyone, and thank you for joining me here today on this beautiful winter morning in the heart of Calgary. Every time I visit Calgary, I'm reminded why Alberta is known for its big skies and of the people who look out for one another. Calgary's energy, resilience, and sense of community truly makes it a special place to live and work. Today marks a major milestone, not just for Calgary, but for families across southern Alberta who rely on the Peter Lougheed Centre. I want to begin by thanking our partners at Alberta Health Services and the skilled tradespeople, architects, engineers, project managers, and planners who helped bring this expansion to life. Your dedication and teamwork turned a vision that began in 2021 into a real and lasting improvement for this region. The Peter Lougheed Centre is more than a hospital. It is a lifeline for Calgary and southern Alberta. Every year, more than 150,000 patients come through these doors for emergency and specialized care. This hospital is a leader in hematology, respiratory care, vascular surgery, and mental health services. And today we are strengthening that legacy. When Albertans walk through these doors, often during some of the most stressful moments of their lives, they deserve care that is timely, reliable, compassionate, and high quality. That is exactly what this expansion is designed to support. This $151 million expansion and renovation project adds space for 97 new patient beds, including 28 new emergency department beds, along with modern clinical spaces that improve patient flow and create a better environment for both patients and healthcare staff. The investment is part of the Alberta government's overarching Budget 2025 commitment of $3.6 billion over 3 years to build, modernize, and add capacity to our healthcare infrastructure across the province. But these expansions and upgrades add real capacity to treat real people with the respect and care they deserve. They mean more space to care for patients safely. They mean better flow through emergency departments, and they mean peace of mind for families when they need help. Strong communities are built on strong infrastructure, and healthcare infrastructure is one of the most important investments we can make. Projects like this support frontline teams, reduce bottlenecks, enable clinical teams to deliver the best possible care, and ensure our healthcare system can meet the needs of our growing province. These investments also strengthened Alberta's economy by creating more than 800 jobs during construction and will continue to support local jobs as these new spaces come fully into service. This expansion is part of Alberta's broader commitment to modernize facilities, expand specialized care, and improve emergency department capacity so people in Calgary and communities across the province can access high-quality care close to home. Our focus is simple: timely, reliable, high-quality healthcare for Albertans no matter where they live today and in the future. As our population grows, we will continue to move projects forward faster, invest wisely, and build the infrastructure communities across the province need. I know everyone here today shares this goal. As we work together, we don't just build facilities, we build confidence, trust, hope, and a healthier future for every Albertan. Thank you. I will now invite Minister Jones to come to the podium.
Good afternoon. Thank you for being here, and thank you to everyone who was involved in the planning, design, construction, and soon operation of this facility. So it's a pleasure to be here today to mark an important step forward in strengthening emergency care for Calgarians and Albertans. Since opening in 1988, the Peter Lougheed Centre has delivered high-quality care to hundreds of thousands of patients. At that time, the emergency department was built to serve 30 to 40,000 patients a year. In 2025, the department reached 83,000 patients. With demand more than doubling, modernization and expansion was necessary. Today, we are delivering on that need. This afternoon, the keys to the new emergency department will be handed over to AHS, allowing final preparations to begin. Since 2021, the site has added 159 patient beds and 4 training beds, and with the completion of this project, an additional 97 patient beds have been added, including 28 emergency department beds. This expansion is part of our government's broader commitment to strengthen Calgary's healthcare system through strategic long-term investments. Just yesterday, we also announced $2 million in planning funds to expand an inpatient tower at the Alberta Children's Hospital, potentially adding 40 acute care beds and 10 mental health care beds, a 32% increase in capacity. That investment is matched by the Alberta Children's Hospital Foundation to support a new Centre for Research and Innovation, ensuring that Alberta is at the forefront of medical research. Through the Acute Care Action Plan, we're planning for over 1,000 net new beds in Edmonton and Calgary, including new bed towers at the Grey Nuns and Misericordia hospitals in Edmonton and South Health Campus here in Calgary. Additionally, we are developing a 50-year capital plan and long-term workforce plan to ensure that we have the capacity and workforce needed to meet the healthcare needs of our growing population. This work complements other major projects, including the $1.8 billion Red Deer Regional Hospital redevelopment, which will add over 200 beds, 6 operating rooms, 2 cath labs, and an ambulatory building. We've also invested $15 million in planning to build 8 urgent care centers across Alberta, including a large urgent care center in East Calgary, which will reduce wait times and improve outcomes and ease pressure on hospitals. Finally, our government is investing $5 million over 2 years to support health services planning in North Calgary and Airdrie. This includes $2 million for the One Health Airdrie proposal and an additional $3 million to complete a comprehensive health services plan for the overall region. This work will identify the right mix of services and infrastructure to support one of Alberta's fastest growing areas and ensure future investments are aligned with community needs. Investing in health infrastructure is essential to the future of our health system. It ensures patients receive timely care and that healthcare professionals have purpose-built spaces that they need to provide excellent patient-centered care. Today marks meaningful progress, and it reflects our commitment to building a stronger healthcare system for Albertans. I would now like to invite Lydia McGraw, Executive Director of the Peter Lougheed Centre Emergency Department, to the podium. Thank you.
Good afternoon, and thank you for joining us today. I'm Lydia McGraw, the Executive Director for the Emergency Department at the Peter Lougheed Centre. Today we're celebrating the completion of our updated and renovated emergency space, a space designed to strengthen our ability to deliver high-quality emergency care for all Calgarians. These renovations focus on enhancing both patient care and the work environment, including updated monitoring systems and clinical technology, an improved layout allowing workflows that enhance efficiency, safety, and team coordination, with redesigned treatment spaces that promote safe, organized, and effective care. These improvements build on our department's long-standing commitment to excellence, helping us to continue to provide consistent, safe, and compassionate care. Emergency care is demanding work. Our teams respond to critical situations, make rapid decisions, and support patients and families through some of the most challenging moments. Providing safe, effective care in the temporary care environment that we've had has required immense adaptability, and the dedication shown by our teams throughout this is a true testament to the resilience and their unwavering commitment. We are also deeply grateful to the patients and families for understanding and by showing our patients during this time of transition. Their support during this time of change has meant a great deal to our teams. This renovated environment strengthens the work through thoughtful design that aligns with modern emergency care practices that helps our staff continue delivering care effectively. Today we celebrate the completion of this renovation. In the weeks ahead, our focus will shift on final preparations, ensuring the space is fully ready to support patients and families. To the Government of Alberta, thank you for your support and for recognizing the importance of investing in emergency care. Thank you for the opportunity to share in this celebration with us today.
Okay, we will now move to the Q&A portion of the press conference. Today we'll keep our questions about the completion of the Phase 2 of the Peter Lougheed Centre, and we'll do one question and one follow-up. We'll start with questions in the room. And if you could just address who the question's going to and introduce yourself as well.
Tim Brook with CTV. My question is for Minister Jones. I guess maybe a two-part question. Obviously, a lot of long-term investments noted today, but on the short term, number one, when can we actually expect to see patients in this new facility, and what's kind of the plan to staff it and to bring in more workers? Because obviously, all our hospitals are a little overwhelmed right now.
Yeah, I believe the plan for this facility is for it to be operational by late February. February 24th, I think, is roughly the date that I saw. And in response to staffing, we've been actively producing and recruiting healthcare professionals. Year over year, we're up about 1,000 RNs, LPNs, and healthcare aides, and over 600 physicians. Alberta is doing comparatively quite well, and will continue to use bursaries, incentives, actively promote the benefits of working in Alberta and living here, and I think we'll continue to see success.
I have a question for Lydia, if that's possible.
It is.
Sorry.
Oh, unless you...
You were getting comfy there. I apologize. My question to you is, do you think the province has equipped you with the tools and the resources you need in order to be effective in your role and obviously in the section you oversee?
I think I actually have to defer that question to Minister Jones.
The simple answer to that is if anyone feels that they do not have the resources or staff required to provide the care that Albertans expect and require, then that's a conversation that we're always willing to have and that we will always respond to. That's one of the reasons that we're building 3-bed towers in Calgary and Edmonton. That's one of the reasons that I secured additional funds to do 50,000 additional surgeries to clear the surgical backlog, and why we are so aggressively recruiting, because you can build all the buildings in the world, and they don't mean anything if you don't have healthcare professionals to staff them.
Thanks.
Thank you.
Next question.
Megan Cobb with Global News, probably for you as well, Minister Jones, or anyone else who can answer it. But so that's 97 new beds, including 28 ER beds. You said late February. Will all of those beds open at the end of late February, or will we see kind of more of a phased approach as we have the healthcare staff to staff them?
My understanding is they will be phased in as they move equipment and people, but I stand to be corrected. And that 97 includes, of course, the emergency department, 28 beds that you highlighted, but also some mental health short stay, psychiatric ICU, and minor surgical or women's health beds as well, for a total of around 97 net new.
And then just in the midst of all of the pressure on the ER, is this expected to help alleviate some of that pressure that our healthcare system is seeing?
I think additional capacity always helps, and then this is also modern and new, so it will support better flow and efficiency of care, which modern facilities are able to do better than dated facilities. So the previous ED was, I think, 62 beds in a space configured for 34. So as you can imagine, that was challenging from a frontline perspective, and this will be a far better environment to work in.
Okay. Next question.
Hi, Rain Rosh at City News. I'm wondering if you can give us a little bit more information about the information you gave us regarding the Children's Hospital, as well as the new urgent care center that's coming in the Northeast Calgary area.
Yeah, so the Alberta Children's Hospital, there's two components to that. We're planning in collaboration with the Alberta Children's Hospital Foundation. The first component is we're looking at an inpatient tower, and so that we're looking at an additional 40 acute care beds and 10 mental health beds, which would increase the capacity of the hospital by about 30%. And the second is a center of research and innovation, where we really want to get frontline care and research integrated so that we can be leading in innovative care for children. And the urgent care centers, so we are batch procuring 8 of these across the province, including in Calgary, Edmonton, Cold Lake, Fort McMurray, Lethbridge, Medicine Hat area, and others. And the idea is, of course, these are net needed, and so by bulk procuring them, there should be cost savings through standardized builds. I will note that the one for East Calgary will be substantially larger than the other 7 because of the density and the catchment area that it will have to serve.
Okay. Next question.
So those are in planning right now as well.
Hi, this is Arzuma Kampore with Radio Canada. So the expansion today is part of the overall plan to actually start alleviating the pressure on hospitals going on right now. What can you tell us about what is being done at the moment? Like all of that is a lot of planning is coming. What is being done at the moment, like today? So the emergencies room that we see even here are not going to be under pressure or alleviated.
Yeah, so it's important to note that the construction process has phases. We're planning, design, construction, and there's projects all around Alberta that are in the process. in the construction process, which actually I'll turn over to Minister Long after this to highlight some of those or the number of those. We're also evaluating our top 16 urban and regional hospitals to see how we can better utilize the space. So if there's things, for example, that could be provided in a different facility, then we would love to move it and backfill it with acute care capacity. This is similar to the standalone stollery that we announced. We want to move the stollery to a standalone facility, and then we would backfill the U of A with adult acute care capacity. We're also evaluating our rural facilities to see what condition they're in, both from just a physical condition, but also an operational. In other words, how are they able to facilitate the care of patients? Do they need to be updated? And that's gonna inform those investment efforts. We're also updating and expanding our surgical facilities, our medical device reprocessing areas, so that we can do more surgeries. So there's literally hundreds of projects that are in different phases of the construction process. And but the bigger thing that I would like to focus on is the 50-year capital plan that I've initiated. It's very important to me that we have a long-term plan for what acute care facilities and services we need and where, based on our growing, aging, medically more complex population, where people are deciding to live, so that decisions are less reactionary and are more planned long-term. And now, Minister Long, can you comment on the projects under construction?
Yeah, thank you, Minister Jones. We actually have 8 other hospitals that are currently in construction phase. 11 more on top of that are in planning and design phases. I don't have a total on the number of beds that will create for net new, but that will be something that we'll be talking about with the Health Ministry on a go-forward basis.
Awesome. So we'll go next question. Okay. And operator, can you maybe put the first caller through?
The next question comes from Sean Amato of City News. Your line is already open.
Hi there, Minister Long. So I asked your press secretary on Friday for a complete list of all hospital spaces under construction in Alberta. I'm still waiting for that. It's been almost 5 days, and he was not able to give me that information. You just said that there's 8 hospitals under construction. Can you please tell us which ones, and why not have a bed estimate?
Thank you, Sean, for that question. Of the ones under construction currently, we have the U of A Brain Centre, Neurosciences Intensive Care Unit. We have the Red Deer Regional Hospital Centre. We have the Red Deer Interim Cardiac Catheterization Lab, the La Crete Maternity and Community Health Centre Intensive Care Unit expansion at the U of A, the Bridgeland Riverside Continuing Care Centre, the Chinook Regional Hospital Renal Dialysis, and Jean Zwozdesky in Norwood.
Okay, next
Okay,
question.
thanks.
Oh, sorry, go ahead, Sean.
Yeah, thank you. Just as a follow-up there, thank you for that list. I appreciate it. Why no bed estimate? Like, people are worried that there's not enough spaces in hospitals. So can you say, are there dozens of beds, under construction, hundreds of beds, thousands of beds? Like, please give us a sense of what relief is coming for Alberta.
Well, as Minister Jones alluded to earlier, between planning and design, we have over 1,000 new bed spaces being contemplated currently. I don't have the complete list of new bed spaces on these construction ones. I will look to my team to get that information.
Okay, we'll go next question. Next, can you put the next caller through on? Okay.
The next question comes from Eve Coate of Radio Canada. Your line is already open.
All right. Hi. My question is for Minister Jones. You're pointing to your expansions and future hospital tower projects, measures that will provide relief. But I'd like to know, how much comfort and reassurance do you think that brings to people who are sick in the emergency room today, like right now?
Thank you for the question. So the long-term building of capacity is only one component of our plan to address hospital and emergency department pressures. So on the front end, we're working on, of course, providing people with access to primary care and diverting patients who are non-urgent to, say, urgent care centers, or perhaps they could be cared for in their home or immediately diverted to mental health and recovery or social supports. Within hospital, we're working with our frontline personnel to work on hospital efficiency to see how we can more quickly flow people through the emergency department up to inpatient units. And on the back end, as you've probably heard, we've had a dedicated effort to transition alternate level of care patients to more appropriate care settings. For some context, at any given time, we have about 1,300 alternate level of care patients in hospital beds. About a quarter of those are awaiting long-term care or continuing care. And each one of those that we are able to move to that more appropriate care setting frees up a hospital bed. So it's a matrix. It's a number of different solutions that we're working on to free up capacity and build capacity and get more out of our capacity. And that's what we work on every day with Acute Care Alberta and our service providers like AHS and Covenant.
And I'd like to hear you, the AMA, some doctors as well as the NDP have said that the health system refocusing has worsened the challenge of responding to ER demands, because no one or singular groups are in charge of coordinating the whole system. And they're asking that a command be temporarily set up to centralize decision-making. Is this a step you're willing to take?
So there is and has been provincial corridor and site coordination, which is responsibility of Acute Care Alberta in collaboration with service providers like AHS and Covenant. There is IOCs in Calgary and Edmonton to assist in these efforts to make sure that we are allocating resources and transferring patients and as required. I am working with Acute Care Alberta and my Ministry of Hospital and Surgical Health Services to evaluate expanding the IOC efforts in Edmonton and Calgary province-wide so that we can maximize that collaboration across the province. Much of our excess acute care capacity is often in rural and remote Alberta, and so obviously we want to help alleviate pressures where possible in the busy urban areas with that capacity. So the short answer is there has always been coordination at the province, corridor, and site level. It's done very well in Calgary and Edmonton, which is why we weathered the respiratory virus season without significant, for example, surgical cancellations, which is one of our levers. And we're looking to expand that further to leverage province-wide command center coordination.
Operator, can you put the next caller through? And this will be our last question today.
The next question comes from Janet French of CBC Edmonton. Your line is already open.
Hi there. Question for Minister Jones. One practical change the doctors are calling for relieving some of the pressure on emergency rooms is to have other levels of care, like long-term care, home care, accept discharged patients on weekends and evenings and holidays. Because when more ER patients show up, there's nowhere for people who are ready for discharge to go. And so how willing are you to make this very pragmatic change?
Very willing. So this is, of course, it's a complex integrated system, and the hospital system is operating 24/7, and sometimes the partners, for example, long-term or continuing care centers, where we'd like to transfer a patient may not be operating at the same time in the evenings or weekends as the hospital, and that does have to change so that we can have more seamless patient flow, particularly for alternate level of care patients. So yes, we are actively exploring this right now. And I'd also like to maximize our incredible facilities better in the evenings and weekends, and we're certainly willing to invest in staffing them and supporting them to do that.
I also wanted to ask you about some of the stories that doctors have shared in this anonymized document with your government apparently more than a week ago, including 6 people who they say died, and that a contributing factor to their death was, in fact, the wait for care. We're talking about, somebody waiting 8 or 9 hours for a bowel obstruction to be noticed and dying of an infection. We're talking about people trying to be resuscitated and dying in hallways when they're being resuscitated. People who left without being seen got brought back by EMS and then died. How acceptable are these situations in your mind?
First, extend our condolences for anybody who has lost a loved one that received care in our healthcare system. It is an unfortunate reality that sick and frail people do access care in hospitals. We have, for some perspective, for some context, the healthcare system in Alberta serves around 30,000 people per day. Our emergency departments see about 2 million visits per year, and in a very small percentage of those cases, 0.07% roughly, people do lose their lives. And that what we try to do is we try to learn from those as a system, and we certainly investigate those as warranted by the circumstances. So the anonymized, unverified data that was shared is concerning to me. It's difficult to comment on it both from a privacy and legal perspective, but also because it is anonymous and the sites have also been redacted. But rest assured, we have a process in place whenever there is an adverse event, whenever there is a near miss or a suboptimal outcome. We have a reporting system that our service providers use. It's the RLS system. It's a reporting and learning system. And that is what we use to enhance our system's ability to care. And as you've seen, there's also quality assurance reviews that are undertaken when there are significant concerns over a care incident. And we also have the Office of the Chief Medical Examiner, and in extreme cases, fatality inquiry can be used. I have met with physicians who have concerns about how patient care is impacted by pressures on our system, and it does. Wait times impact patient care, and our hospitals and emergency departments are busy. I've met with physicians. I've offered working group meetings between Acute Care Alberta, my department, and the AMA. And all day long, we want to work with everyone to make the system better and improve care. I want to be very clear that if someone requires critical care, urgent care, they should seek it, and they should have confidence that they will get it. And I don't feel that these anonymized cases are representative of the incredible care that our system and our frontline healthcare professionals provide on a day-to-day basis. I do take them seriously. We must learn from them. But we also do incredible work every day for Albertans and their families.
Awesome. And that concludes our press conference today. Thank you, everyone, for coming out for the announcement on the completion of Phase 2 of the Peter Lougheed Centre.
Thank you.